just waiting to listen to this. Thank you. Thank you so much.
Good morning, everyone. I am Israa ElAmeen, an assistant lecturer of diagnostic and interventional radiology at Ain Shams University. I'm honored to be among you here today. Today, I'm going to talk about the checklist for AI in medical imaging. Okay. Now I'm going to take you through a short journey of how you can formulate a research paper if you are going to discuss a topic related to the AI. So the first thing in your research paper is definitely the title. In your title, you need to tell us that this is an AI study. And you need to specifically categorize the technology you're going to use. For example, if it is deep learning. Next, we'll go to the abstract. Like any abstract, we have to talk about the study design, whether it's a prospective study or a retrospective one, the methods, the results, the outcomes you got out, and the conclusion. You need to talk about the study population. But regarding the AI, we need to focus about certain points. First, we have to talk about the software we're going to use. You have to talk about the data, the AI model, and whether those models are publicly available already or not. You also need to talk about the data partitions and the level of the data splitting, the patient level and the image level and the series level. And next, you're going to talk about the introduction. In the introduction, you need to give us a clinical background on your topic. You need to let us know what is already known about your topic. And then you have to let us know what your AI model is going to add up on what is already known. You need to let us know your study aims, objectives, and hypotheses. And now we're going to go to the methods. First, you're going to talk about your study design. You need to let us know if it is a prospective study or a retrospective one. You need to talk about your study goals. We need to know if this is a model creation, an exploratory study, and you need to let us know if the classification of your study, such as it is for risk assessment or for screening, for diagnosing, for staging, for monitoring, for whatsoever. But you need to let us know. And now we're going to go to the data part. First, your data sources. You need to provide links to your data sources, to the images, the software you used for your AI model. You need to talk about your data pre-processing and the selection of the data subsets. You need to let us know which subset of images you extracted, the cropped portions of the images, or whatever segments you extracted of the report. You need to let us know your de-identification method, how you hide the patient's data and information. And next, you need to let us know how the missing data were handled. In any research we do, there's usually a missing data. Maybe patients who dropped out or whatsoever. You need to let us know about this. And finally, your image acquisition protocol. For example, the MRI sequence you use, the CT scan, the scan time, the slice thickness, whatsoever. And now we're going to go to the reference standard. And what we mean by reference standard is how your AI model performance is measured. So, at first, you need to give us a definition of the method you use to obtain your reference standard. And this has to be very clear. No vague descriptions are allowed here. For example, if we're talking about an MMS lesion study, for example, you need to let us know in details how you measure this, the 3D dimensions, the exact location. What was it, juxtacortical, periventricular, infratentorial, wheresoever. So this has to be very detailed and very focused. And now we'll go to the rationale for choosing the reference study. You need to let us know if there was any alternatives or not. And you need we need to know your potential errors, your bias, and the limitations of that reference standard. You will also have to involve the source of your reference standard annotations. As to say, you need to specify the number of the human annotators, the level of your qualifications. You need to describe exactly how the training was given to the annotators. as well as the annotation of the task set, and finally, the measures of the enter, rater, and intra-rater variability features described by the annotator. And now we'll go to the data partitions. At first, you should give us information how your data were assigned to partitions. You have to specify how the data were partitioned into the training stage and the model optimization and the testing part. You need to let us know the proportion of data in each partition. For example, here was 80, there was 10, there was 5, and you need to let us know why there was difference between the different partitions. You need also to let us know at which level the partitions were disjoint, so that there will be no overlap between the different imaging series of the patients, of the same patient. And finally, don't forget to mention your sample size. Okay, and here comes a very important part, or let me say this is your core. It is the model. You will first mention detailed description of your AI model. And you will have to mention your software libraries, frameworks, and packages, and the initialization of your model parameter. And now we'll go to a very fundamental part, which is your training. You will have to tell the details of your training. As to say, you will have to describe how the training data were augmented, how the training of each model was monitored, on which criteria did you decide to stop training, how did you select your best model, the values you used for every and each parameter. And it's very, very important to highlight the method you use to select your final model and the ensembling technique. Now we'll go to the evaluation. You will have to say the metrics of your model performance, the statistical measures of significance and uncertainty, your sensitivity analysis, the methods of interpretation, the evaluation on the internal data as well as the external data. And very important is the clinical trial registration. It's very important that we all try to register our clinical trials so that we can always come up with new clinical trial studies without overlapping and repeating the same clinical trials. Okay, and here is the results part. At first, it's very important to let us know what was your inclusion criteria and exclusion criteria regarding the patients and the examination. And this is best demonstrated in a flow chart to let us know exactly how did you start and why did you decide to exclude whatsoever regarding the patients or the examination. It's very important to talk about the demographic and clinical characteristics of cases in each partition. And if there is a clinical characteristic and demographic difference, you have also to mention this. And now regarding the model performance, you need to talk about the measures of the performance and the statistical uncertainty using the standard deviation, and the estimates of diagnostic performance, as well as the failure analysis of the incorrectly classified cases. And now the final part of your paper is the discussion. You have to say your study limitations. So if someone is going to perform a new study, they may try to avoid this limitation so we can help innovate further clinical studies. It's very important to let us know the clinical implication of your AI model, because this is actually the main reason you perform this research paper. Other information is to provide a reference to your full study protocol. It's important to tell us about the availability of your software, trained model, and data, and references for those, and the sources of your funding. And that was all regarding my part. Thank you so much.